Muted.
We're glad you're here to join us today for this month's topic, medication safety, presented by Trisha Menoni from Partners in Senior Care. Our speaker is the founder of family-owned Partners in Senior Care. She's been a nurse for over 45 years, and 20 of those years have been helping seniors and their families navigate the aging journey. So thank you, Trisha, for talking to us today about medication safety. We appreciate having you here. And go ahead.
Thanks so much, Nancy. Before we begin our talk, let's begin with some of the facts so we understand how very important this is for everyone, especially the senior population. 67% of Americans over the age of 50 take an average of 4 prescription drugs daily, and that's only the average. So many are taking greater than 4 prescriptions daily, and many of these prescriptions are taken more than once a day. We'll talk about some of how that math falls out a little bit later on. Older Americans additionally use many over-the-counter medications, low-dose aspirin, vitamins, calcium. Those are just a few that come to the top of my head. I only take 1 prescription medication, but my eye doctor has me on several vitamins to help prevent macular degeneration. So I take a total of 4 pills in the morning and 5 in the evening. My mother-in-law, however, has 11 prescription medications and 1 over-the-counter vitamin. That translates to 13 pills in the morning and 7 pills at night. She's 96 years old. That's a lot to keep track of and a lot of potential for error. Obviously, the more pills one takes, greater that margin of error. Did you know that most drug studies are done on 25 to 35-year-olds, but most of those drugs are taken by those over 60? Can you see any problem with that? I sure can. As we age, the way we absorb, distribute, metabolize, and excrete medication changes. If someone has been on the same dosage for 10 years or more, it might be a good idea to ask the doctor to review the dosage. Has their weight gone up or down? Has there been a change in the last 10 years? Many drugs are metabolized in the liver. Have there been any liver changes? Especially if someone is a heavy drinker, their liver changes. As we age, our liver function changes. Diet and alcohol also can affect medications. So it's important to ask, are there changes in alcohol usage? What about, are you on a statin for high cholesterol? Lipitor, Crestor. Did you know you shouldn't eat grapefruit or drink grapefruit juice if you're on a statin for high cholesterol? Many people don't realize that, and it affects the way the medication acts. How about taking Coumadin? Many people do. It's a blood thinner. If you're on Coumadin, you should not be eating foods high in vitamin K. How many know what's high in vitamin K? That's green leafy vegetables. But as I researched this, I also found out it's commercially prepared chocolate cake. That's the cake you buy at the bakery. Really good, but it has 40 micrograms, or half of the daily recommended amount of vitamin K. So if you're on Coumadin, maybe you should be only having half a piece of chocolate cake, and maybe only about once a week. Makes a difference in many people's lifestyles. So there's things we don't think about or even know about. What about drug interactions? Drug interactions occur for 2 reasons. Either the two drugs cancel the effectiveness of the other, or they increase the way the medication acts. Many of us see several doctors, so it's really important. Do your other doctors know what's been prescribed? Are you bringing a list with you so that they know? We're talking prescription medications, but do they also know about your over-the-counter medications? We've already talked about drugs reacting with food or beverages. So those are the facts. The older you get, the more prescriptions. Multiple times to take that prescription. Therefore, you have a lot of pills to take or forget to take. The more doctors you have means there's a greater possibility of less oversight of the big picture. Gone are the days when you had the family practice doctor that handled all your needs. Many seniors are seeing a primary care doctor, cardiologist, a urologist, a neurologist, who's looking at that big picture. The more prescriptions you have, the greater the possibility of a negative interaction. It's also been said that anyone that is on more than 12 prescriptions begins to get prescriptions for the side effects of the medication. So what's a person to do? Well, the very first thing is a very simple thing. Keep a list. Make a list and include all of your medications. That's prescription medications and over-the-counter. We've included in the handouts you received a very simple, easy to follow, make a list form, and we'll look at that in a little bit. After you've made a list, take a copy to each and every doctor you see, and that's each and every time you see them. Ask them why you need to take the medication. Sometimes your life has changed and it's not always necessary. Ask about any interactions with the other medications that you're taking, and ask about the side effects. The other person you need to share that list with is your pharmacist. Ask the pharmacist to review your list of medications when you have a prescription refill. Make sure your pharmacist knows what over-the-counter medications you're taking. And I always recommend, before you take an over-the-counter medication for a cold, seasonal allergy, nausea, diarrhea, ask the pharmacist for advice of which medication you should take in light of the medications you are already on. Some over-the-counter medications can affect your blood pressure. And if you already have hypertension and are taking a medication for that, you don't want to be taking a cold tablet that's going to raise your blood pressure. The pharmacist is the best source of information regarding drugs. It's their primary job. It's not the primary job of your physician, but it is of your pharmacist. They know the most about medications. So you keep that list, and you update your list every time you see a doctor. That might only mean changing the date if there are no med changes. Now you say, why should I change the date? Well, that way people know that the list has been looked at. Some people keep a list in their computer and then can email it or share it with their adult children. If you keep it on a piece of paper, then just at the top, say updated and today's date. Let the important people in your life know about any changes. They're the ones that are going to speak for you in an emergency. That includes your spouse, your power of attorney of health care, adult children. Maybe it's a neighbor, but you need to have that list. If you live alone, it might be advantageous to put that list on the refrigerator. So if there is an emergency and the paramedics come to your house, it's right there on the fridge. Put a copy in your purse or your wallet. If you have a medical emergency when you are out and about, that's where the paramedics are going to look, in your purse, in your wallet. If you're an adult child listening to this, talk to your parents about your need to know and set up a reminder on your calendar to just ask for a new list every quarter. That way, if they've seen a doctor and medications have changed, you get a new list. Sometimes we just forget to ask, and all of a sudden the list you have is 3 years old. I oftentimes see that in senior living communities. Seniors fill out a lot of forms when they enter that senior living community. And if they're in the independent part and see doctors outside of the community, their emergency medical list never gets updated. So that's another person we want to talk about sharing that list with, the wellness nurse at the senior living community. So now here's a picture, a sample of the medication list. And as you can see, it has the name of the medication, the dosage, frequency. How often do you take it? Twice a day, bedtime, in the morning. You also want to put the start date. When did you start taking the medication? And I tell people this needs to be a running list because you need an end date. And you might want to, on the back of the sheet of the paper, say why you stopped taking it. Did you have an allergic reaction? Did they switch you to a different medication? You also want to list the physician that ordered it, and that will give those that are helping care for you the ability to know who your doctors are. Okay, so we've made a list of the medications, and we've shared it with all those important people. What other kinds of things do we have to do in order to ensure that we're taking the right medication and that we know about the medication? This is about safety. So I suggest people have a medication sheet for each drug. Now, I hear some of you saying, well, I get that from the drugstore when they fill my medications. That's right. And when was the last time you read it? Or do you open up the bag, take out the prescription, and throw the bag and that medication sheet away? Sometimes you can use that information you get from the pharmacy to make your own medication drug sheet. Sometimes you might want to talk to the pharmacist to help you put it together, or your physician. This is what is important for you to know. You're not the pharmacist. You don't need 3 pages of information. What you need is the name of the drug. That's both the brand name and the generic. The frequency that you take it, the dosage, the number of pills. You also want to know the manufacturer. Now check this out when you get a refill that looks different, because oftentimes our doctor says that a generic can be used, and that's perfectly acceptable. Pharmacies have a generic for that drug. Lasix comes to mind. And they often get their generic drugs from different manufacturers. The dose is the same. However, each manufacturer uses other things, different binders, to keep that medicine together and make it into a pill. So you get a new pill. You used to always be yellow. Now it's pink. first thing you want to do is ask the pharmacist, is this really the right one? I always took a yellow pill. Now it's pink. And the pharmacist assures you, it's just from a new manufacturer. All right, so the old pill was manufacturer A, and the new pill is manufacturer B. You want to notate that on your medication drug sheet. Sometimes you've been on a pill for a long time. You've been on that wonderful little yellow pill, and it's never caused problems. Now all of a sudden you're taking a pink pill, and you're not feeling so hot. It might be that you're having a reaction to the binder that's in it. So sometimes you need to say, can we go back to the other manufacturer? Maybe you need to go off the generic and onto the name brand. That's something to discuss with your doctor and the pharmacist. So, what are the other things that you need to have on that medication drug sheet? Well, you need the reason you're taking the pill. Talked about Lasix. That's a water pill. You're taking that because you're retaining fluids. You could be on a high blood pressure medication. Or as I said, you could be on Lipitor, and that's to lower your cholesterol. So why are you taking it? Then are there any special precautions? Remember we said if you were on a statin, you don't want to take grapefruit juice? Write that down. Then are there any possible side effects? If you looked at any flyer, they might list 20 different side effects. Nausea, vomiting, diarrhea, constipation. I always find that interesting that you can have either diarrhea or constipation from the same drug, but you can. So you want to ask the pharmacist or your doctor, what are the most common side effects to look for? And then the next follow-up question is, what should you do if you have a reaction? Should you stop the med? Just call the doctor? Makes a difference. Some medication you shouldn't just go cold turkey. Sometimes you need to substitute a medication right away, and others you could stop taking until you see the doctor. But the one that you need to call to make that decision is the doctor. So what are the possible side effects? What should you do if you have one of them? And when should you call the doctor? So again, we've included one of those medication info sheets in your handouts. It's fast, it's easy to do. So look at this one, Lasix, and the generic name is furosemide. Dosage you're taking is 20 milligrams, 2 pills, and you take it in the morning. You also might want to note with Lasix, don't take it after 2 p.m. I was out with my mother-in-law the other day. We had a funeral to go to, and she said, I didn't take that little water pill this morning because I didn't want to have to be running to the bathroom during the funeral. I said, that's a good decision. She said, yes, I'll take it tonight with my bedtime medicine. I said, oh, no, Mom. You need to take it as soon as we get home at noon, because if you take it at 10 o'clock at night, you're going to be up peeing all night. She said, I didn't think about that. So I said to her on her little sheet, never take after 2 p.m. That's really important. So what are some of the possible side effects? Well, call doctor if I stop urinating or have a peeling skin rash, and that's one of the reactions. So those are the reasons to call the doctor if you're taking Lasix. Each medication is going to have different side effects. So when you go to your doctor and you get a new prescription, you're going to want to say to him There are 7 questions you should always ask the doctor when you get that new prescription. What is the name of the medication I'm going to be taking? That's the first thing. The next question is, how often should I take it? Next big question is, why is it being prescribed? You need to know why you're taking the medication. And then this is a really big one, and one people fail to ask. Is it replacing a medication I am currently taking? So maybe your high blood pressure isn't being controlled well enough on the medicine you're on now. The doctor gives you a new one. It's replacing the medication. And if it's replacing it, the very first thing you do when you get home with the new medication is throw out the old pills when you get the new ones. Now, I hear a lot of people saying, but what if they put me back on it? Maybe I could save that and give it to someone else. Number 1, don't give your pills to anybody else. Throw out the prescription because you don't want someone else to come in a medical emergency and start giving you both the old and the new pills because they're both sitting there. So don't be penny wise and pound foolish. Get rid of the old medications. Next question you ask, will it interact or affect other medicines I'm taking? Remember, I told you to bring that list to the doctor and you say, here's all the medicines I'm on. Any interactions with the meds I'm on? When can I expect to see the results? Everyone thinks it's going to happen immediately. Some meds work immediately. Some medications take a while to build up to a therapeutic level. And you need to know, when can I expect to see the results? When will my blood pressure go down? When will I start feeling better? Then again, remember to ask, what are the possible side effects? And what should I do if they happen? So, we also want to use the same pharmacy. Now, I know many people use mail order pharmacies, and that's fine. And if you want to talk to a pharmacist at that mail order pharmacy, look at the back of your drug card, look at the bottle that they send you. There is generally a customer service number. And don't be calling it at 10 o'clock at night or on the weekend because you're not going to get such great customer service. But during business hours, from about 8 to 6, you can call the mail order pharmacy and ask to talk to a pharmacist because you have questions. You also can do that at your neighborhood pharmacy if that's the pharmacy that you're choosing to use. So you use the same pharmacy for all prescriptions, and this helps to prevent incompatible drug combinations. Remember how I said take the list to the doctor? Well, if you use the same pharmacy, many of their software will red flag right away if there's a bad combination. And when you go to when you need to buy some over-the-counter prescription, bring that list with you, talk to the pharmacist, and ask them to recommend which cold tablet you should take, which allergy medication to take. You know, there's a whole aisle that says cough syrup. Some are going to react well with the medications you're on and some aren't. So ask the pharmacist. Even if your neighborhood pharmacy, whether it's Walgreens, CVS, or Jim Johnson's pharmacy, if you're buying the over-the-counter from them, they're going to be able to look at your list that you're using from your mail order pharmacy and tell you which over-the-counter drug you should be buying. So read that customer information sheet before you leave the pharmacy. So if you have any questions, you can ask. Then you know what to put on your sheet when you get home. I always suggest to people to order their refills before they run out, about a week before you need them. This prevents any problems. Sometimes you need a prescription refilled and they need to call the doctor. Sometimes the medication you're on is a special order and they need to get it from their supplier. So giving people a week to refill your prescription is always a good idea. So what are some other important tips? Well, follow the dosing directions. That means morning and bedtime. Means just that, morning and bedtime. Drugs reach their peak at different times. Talked about Lasix. Taking it at bedtime, keep you up all night going to the bathroom. Statins reduce your cholesterol, and they should be taken at night. Do not chew, crush, or break any capsules without checking this out first. Sometimes they're time release, so crushing them is going to totally make them act the wrong way. Never take medications that are prescribed for someone else. Oh, I had that. Let me give you a pill I had. No way, Jose. And never give your prescriptions to someone else, even though it says it's the same medication and same dosage. This is not a time to share. You need to store your drugs properly. That means avoiding heat, humidity, and light. So bathrooms aren't the best place to store them. The cabinet over the oven, not so good. And sitting on the windowsill ledge in the kitchen, definitely not. So keep them in a cupboard away from heat, away from humidity, and away from light, and out of the reach of children. You also need to dispose of them properly. Don't just flush them down the toilet. If everyone did that, we could have a problem with our water table. You need to check with the pharmacy on how you should dispose of them. Oftentimes you can bring your unused medication back to the pharmacy, and the pharmacist will be happy to take care of it for you. So now, how do you keep track of all your medications? Let's talk about some very, very simple medication reminder systems. Simplest thing you can do is a checklist, and I think I have this, and we're going to show that on the next slide. But just a simple checklist that lists your medication, the times you take it, the days of the month, and you just cross them off as you go. That's how hospitals always did it when we had paper charts. Sometimes a calendar works. You need to take an antibiotic for 7 days. So you write down the dates you're supposed to do it, and as you take the medication, take out your red pen and cross it off. Now, if you have a lot of medications, like my mother-in-law that takes 11 prescriptions, 1 over the counter, 13 pills in the morning, 7 at night, I fill those up for her in a medication reminder system, and that's that little box there. She has one that has 2 slots because she only takes them in the morning and at night. My husband takes his medications 4 times a day, and he puts his in the one that you see, that's yellow, pink, blue, and purple. And that way he remembers to take them morning, noon, and night. The big advantage of doing that is if something happens. I think of my mother-in-law the time she got the flu. Then we knew when she had last taken her medications. She was too sick to tell us. It was a very simple, easy way. We just looked at the medication reminder box, and then we knew where we were. You can get some very sophisticated systems. ADT has them. Philips has them. And they come with reminder bells. They also don't. So if you're dealing with someone that you're afraid might over-medicate, this locks you out. You can only take it when the bell goes off and they drop into the slot for you to. So those are 4 really easy ways that you can remember to take your medications. Any questions, Angie?
Let me see.
It does not look like we have any questions at this time. Thank you so much for joining us. We're glad you joined us here for today's Lunch and Learn webinar. Please join us next week or next month, save the date, January 18th, for our Lunch and Learn webinar series, Navigating the Journey of Life.